This is the day, the only show that keeps you company as you drive home, gives you an opportunity to share what you've gone through during the day, and keeps you up to date with news info from all counties and around the world. This is the day. This is the day.
Hello and welcome to This is the Day. My name is Harriet Kinga, and today I have a guest in studio. Her name is Dr. Rasha Kelej, CEO of Merck Foundation, and today we're talking about infertility, and the misconceptions about it here in Africa. Welcome, Dr. Ari.
Thank you very much.
Yes,
I'm very happy to be here.
I know, and this is something that is very interesting and a topic that people shy away from.
Yes, definitely.
Yeah.
I mean, in many cultures, as you know, specifically infertile women suffer discrimination, ostracism, violence physically and psychologically, and always be the one who blamed to be infertile. While if you know that 50% of infertility causes due to male factor, so men are responsible for infertility as much as women. So they have to share that.
I like the fact that
shared responsibility.
Yeah. But before we get to who's responsible or who is affected, what are the causes?
I mean, there is too many causes, but if you know that 85% of the infertility causes are due to untreated infectious diseases. Infectious diseases due to unsafe abortion, unsafe delivery, STDs, or genital mutation, or child marriage. So all the practices we are advocating against every day can be actually a complication for it, can be the infertility. So prevention is very, very important to eliminate a high number of infertility in Africa and developing countries.
Yeah, all right. And then is it affected by age? Does it matter what age you are?
No, I mean, the productive age is from a certain productive age as up to the menopause, and after that, of course, there is no production of follicles.
Yeah.
But infectious diseases can affect men and women.
Yes.
Adolescents from the age they, up to 14 years old, they can have, depends on the practicing sex. So safe sex, practicing safe sex is very important for prevention of infertility as a complication of STDs, and also avoiding risky behavior.
Wow.
Definitely.
Wow.
So it's actually very much aligned with all the awareness campaigns we do for HIV and infectious diseases, STDs, and also with advocacy with genital mutation, child marriage, because all this can cause infection, and this infection sometimes many times that don't have any symptoms or cannot be diagnosed. So what happens is manifested in the reproductive health from very, very early age, and to the time when a woman or a man try to have a family, and then it will be too late because they lost productive system function.
And things like PID, they don't manifest in any way? Pelvic inflammatory disease?
Definitely, yes. Well, infectious diseases can affect, pelvic, inflammatory diseases, and it can also, it's a factor of the infertility, definitely.
Yeah.
So when we start avoiding or preventing the STDs from the start, like chlamydia, syphilis, and other things, will very much help preventing infertility. But also there's a lot of other things can prevent infertility, like practicing a healthy lifestyle, exercise regularly, eat healthy diet, stop smoking, limit alcohol intake. All these things, avoid the exposure to toxin like paints, pesticides, chemical exposure. All these things can affect infertility in men and women, affect the sperm production and follicle production as well.
Wow. Okay. And then talk about the effects of infertility.
The effect of infertility?
Yes, when it starts from the infection, then you end up being infertile. What are some of the things that just manifest, apart from depression, of course?
Of course, you know that culture perception and social perception of infertility. In many cultures, as I said, infertility is a stigma and a taboo, and many people don't want even to share this information with the doctors. Men does not want to admit that they can be infertile, while infertility has nothing to do with the manhood of a man at all, okay, or his sexuality. So I encourage all the men to share the responsibility responsibility of their wives, support their wives, go and test and get tested with their wives, and share the journey of treatment, because this is the only way to have a beautiful, happy family. Yes.
And then when you're talking about infertility in Kenya, let's talk about it in Kenya. Is the Merck Foundation involved in this? And are you also just creating awareness and capacity building?
No, we have many things we are doing for. First of all, Merck More Than a Mother is a campaign we created, and it's a historic campaign because there is no other organization or governmental or non-governmental organization approach this issue with this comprehensive way. So we, apart from raising awareness about infertility prevention and management, we also building capacity by sending doctors for training to be fertility specialists and embryologists. In many countries, not only in Kenya, there is many countries that don't have fertility care at all. We're making history there, like Sierra Leone, for example, and Liberia and Gambia. We don't have the infertility. We're sending the first infertility specialist, which can help a lot of women and men and couples, because sometimes there is very few cases, many cases actually, can be treated with a very, very small intervention. But if you have the fertility specialist available. And of course, we're building capacity advocacy by trying to change a culture of disrespecting and mistreating the infertile women, and consider her like no value simply because she cannot have a child, which is not fair and it's not correct. And we want to tell the community and raise awareness to gain the sympathy of the community and tolerance for infertility. It's not a taboo, it's not a stigma. Exactly like we did with HIV long time ago. Now HIV is not a stigma anymore, and people are getting tested, get treatment, and they live, and actually people die from diabetes and hypertension and not dying from the HIV.
Yeah, true.
So we want to reach this level of breaking the stigma around infertility and infertile women specifically.
So far in Kenya, how far?
Actually, it's very good reception. And we had said that we want to even take it further to different levels by taking the media as a very important and concrete partner in this campaign. So we created a recognition award, media recognition award for Merck More Than a Mother. We inviting all the journalists, either multimedia, online, print, radio, to propose their stories about infertility and infertile women, and to augment the story so we can make a change of the community, as we said, and create culture shift. And the award will, the applicants will be screened by a scientific committee, and consist of judges like Mr. Tom Shendy and William Bike and Mrs. Renee from Capital FM and Mrs. Carol Mendy. So all plus me. So we will judge the awards, and we have two categories: for journalism, who is already practicing, and for the students, journalist students, because I know that young and youth, you know,
you
will have
you
different.
want to use this to create awareness using the media?
Yes, because when you encourage them, they will go behind the award after that, beyond the award, and they will take it for further to their communities and their articles and media outlets. Definitely.
Right.
Yes.
That is Dr. Rasha Kelej, and she's also the CEO and CEO of the Merck Foundation, talking to us about infertility, misconceptions about it here in Africa, and what they're doing as well as a foundation just to create awareness. We're talking about infertility and the misconceptions here in Africa. And in studio, I have Dr. Rasha Kelej. She's also the CEO of Merck Foundation, talking to us about that. And before we went on a break, when we were playing music, we talked about the effects, the causes, and also who does it affect most. So men sometimes feel like, no, it's a woman's fault, or no, it's the other way around. Well, the doctor has said it.
50%.
Yes, it's not just a woman's problem. So as we continue now, let's talk about the rural areas. How do they get to hear about the information and what's happening?
Yes.
And how do they, you said you create awareness and capacity building,
definitely.
but are there things that are being done just to make sure that you get to different parts of the country?
Definitely.
Yeah.
We actually, the main focus for us is the rural area.
Yeah.
Because as we said, we're partnering with the media and the social media to reach everywhere. And we have the materials of awareness in all local languages. And of course, in each country we go, we have ambassadors.
Yeah.
Ambassadors who can have platforms in rural areas and different communities stories and speak about it. And usually we have plus the first lady, for example, of the country, like first lady of Sierra Leone, first lady of Central African Republic, first lady of Nigeria. All are ambassadors for Merck More Than a Mother in their own respective countries.
Yeah.
Plus ministers of health, the Minister of Health of Uganda, Minister of Health of Ethiopia, Minister of Health of Sierra Leone. So above this, of course, we have our campaigns in different rural areas and community. I actually go by myself. And I send my team to try to get the stories and to amplify the stories to the community and speak to the community to change. I actually was there in Uganda, for example, 2 months ago.
Yeah.
And we established like small businesses for the infertile women who cannot be treated anymore.
Yeah.
Because they know that if they can be treated, we are helping them to know how the management and treatment and everything. But some of them are very old to get treated, and some of them biologically conditioned. The condition cannot be treated due to the loss of their reproductive health function due to the untreated infectious disease since so long. So we do combine them or structure like small groups consist of these infertile women, and we establish for them small businesses. We train them how to manage their businesses. We done chicken farms, cow farms, and restaurants and catering businesses. And I already actually, with the Minister of Health of Uganda, we opened a chicken farm for one of the infertile women. Everyone can see it on our social media, Merck More Than a Mother, Facebook and Twitter and YouTube. And you see how the transformation of these women. You cannot imagine how the transformation from desperate, depressed, feeling worthless women to being powerful, strong and happy and actually dancing and having their own income, being independent. The community also respects them. But again, I don't believe the community understand and realize that they are doing a big mistake. Because I don't believe that people are evils. No way. Because when we speak to the community there in open session, many, like hundreds of people, men and women, they actually told us, we didn't know that it's wrong. We didn't know that we are hurting these women. Now we know. Now we are not going to do it. Now you come and told us it's wrong and incorrect. We are not going to do it anymore. So actually we need the media, and everyone can reach to these little places to tell people it's wrong, it's not fair to treat women this way, or men, or not tolerate them because simply they cannot have birth, they cannot give birth, they have something wrong with one organ on their body. So it must be something bigger than this, than being only giving birth.
And then with all these people on board, you've talked about different people from different countries. What are they doing, or what has been done to ensure that maybe there are clinics closer to the people in the rural areas? Is there anything that has been done in regards to that?
Look, I mean, in every clinic, which is already, there is a lot of clinics in the rural area, which is to manage basic medicine. And there is also HIV programs and maternal health and mother and child programs. So we integrate all the awareness about infertility, prevention, management, and male infertility in these structures. And these people also have different campaigns about cancer, diabetes. We integrate with it, so we don't create a completely different infrastructure. So we are actually managing it with a very cost-effective way.
And what are some of the perceptions people have about infertility now that you've actually gone down into the root itself, and then you've actually met these people, and some of them have actually said the things that they believed in before you changed their perception? What are some of those things?
They think that being infertile does mean that it's being cursed or witched or bad, giving bad luck to actually they blame only women. There is no men infertility at all. As they believe they believe there is no male infertility. So women who has infertility, they are worthless, they are witches, they are cursed, they don't have to accommodate with them or associate with them. They're not invited even to funerals. And some of them thinking that they are prostitutes because that's why they are infertile now, because what they done before marriage. And many bad perception, which is not correct actually at all, because I believe that they don't even know that who is the cause of infertility without going to the doctor. How do you know? So we encourage men to speak openly and discuss their infertility and tell them that it has nothing to do with their manhood or sexuality. It's completely different, because he can be having a very weak man, sexually, and he has many children, and the opposite there. It has nothing to do with it.
And then we've had cases where people are misdiagnosed. Yes. They go together as a couple, and then you find that the woman is told, no, you cannot give birth, you're the one with the issue or the problem, and the man is fine. And then later on, the man passes on, or it was not, this is a true story, this happened actually. Definitely. The man passed on,
of them,
and when he did, she met someone else and she got pregnant. So what happens that there's actually misdiagnosis is that the woman is the one who's checked half of the time, and the men are never they never go through this rigorous
that's why
tests.
we're doing this training, because we have to actually develop also and define policies to regulate fertility care and to audit fertility care, because there is a lot of doctors can actually claim to have to be able to treat infertility and have the skills and capacity, but they are not, and this will waste a lot of time and effort and money for the couples. So I'm very happy that the couple already went to the doctor. This is a good start, because he went to examine, but the doctor couldn't examine the both of them, so he came back to his perception and believed it's a woman, must be a woman. So he just blamed her, and of course he has proven that it was wrong, and the woman could have children after the passaway of the husband. So that's why we are sending a lot of doctors from different countries to training and to be specialized in fertility care, so to make sure that they can diagnose properly, they can treat properly, they deliver the right messages, either prevention or awareness or management. They can advise both men and women, husband and wife, about what they can do and the best options for them.
And question would be, the training that the doctors are going through right now, is it different from what they go through when they're doing gynecology?
Of course, definitely. It's completely different. It's subspecialty.
How different is it?
It's a subspecialty. It's when you are gynecologist, you study certain things, but when you want to specialize in one topic like fertility, it's completely different study, and it has also practical part which they need to practice. That's why I insist on all the training within the doctors that it has to be practical training. So they have to see the patients, they have to treat them by themselves. We send them to places like India and Indonesia, where there's a lot of turnover of patients, and they can do actually also IVF, and they can do technology, and they can diagnose and treat. Practical training. So it's different than the gynecologist. You need a further specialty to be an infertility doctor.
Definitely. So it's not what people actually, the kind of treatment people get, and they think they're going to get the right treatment. That's the reason as to why there's a lot of misdiagnosis.
Yes, I mean there is a lot of gynecologists, and maybe they have proper training, but that's why we need to regulate and audit this. So before the doctor put in his board in front of the clinic, that infertility specialist needs to have the license from the Ministry of Health that he is really went through the training and the practices and all this to be an infertility doctor. If he is IVF specialist and have IVF center, the Ministry of Health was auditing parts. They need to see if the right equipment are there, if it is safe, if it is hygienic enough, if all these things need to be done to facilitate and ensure there is safe and cost-effective fertility care in place in the country.
Another question would be, they use the same test to determine
the
difference between the two? Different tests.
For each, for men, different tests than women. Of course, there are different tests. And the fertility specialists will always be trained to do both. Definitely.
All right. I'm Harriet Kinga. This is the day, and of course today's topic, infertility, talking about the misconceptions also in Africa and how people perceive women who are actually infertile. And is it a man issue as well? Well, Dr. Rasha Kelej, also CEO of Merck Foundation, is talking to us about that, and she's also mentioned things about causes and how you can also get misdiagnosed if you go to the wrong place, and how right now they're just creating awareness and capacity building in different areas in the country as well as Africa, just to make sure that everyone gets to find out what infertility is about, what can be done, and learn something out of that. Welcome back.
Thank you.
Now let's talk about secondary infertility. Yeah, mention that.
Harriet, of course, there is primary infertility and secondary infertility.
Yeah,
Secondary infertility, which is infertility after having the first baby. So can be due to many things. One of them actually infection as well, which is after the first baby delivered and unsafe delivery, which can cause infertility the second time. So it doesn't mean that when you have a child, it means that it's still
you're safe.
Yeah, you're safe. You still have to prevent. You have to always have regular checkup to see what you can do for if you want to have a second baby, which we also advise everyone to have maximum 2 babies, because then I mean it will be balance and I mean happy family. You can afford to keep them and guarantee for them happy life.
And you talked about someone actually getting secondary infertility from infections. Are there specific infections that definitely if go untreated will cause infertility?
Anything in reproductive health and genital infection or reproductive health infection, testicle infection or genital infection. This is part of the reproductive health. All the reproductive health, any infection in any part could cause infertility if it's not treated early enough, or caused any damage, irreversible damage to the organs of the reproductive health. Definitely.
The same thing applies also to men, right?
Definitely, to men as well as men, as women. They can also have infertility due to infection diseases, which is not treated properly. So practicing safe sex and avoiding risky behavior for men and women, young and older, is very, very important to avoid having infertility. It's very important.
Okay. And then you also talked about hormonal issues.
Yes. And this is, of course, there is some issues will be hormonal and can be treated by hormonal therapy, and that's why it's very important to have a very good trained doctor who can manipulate these hormones in the body, because it's not easy. It's very difficult. Hormonal treatment in general in any diseases or conditions is not easy. It needs a very good skilled doctor who knows how to change and increase and decrease.
Let's make us understand this. If you have an issue with your hormonal imbalance, if someone has, it can actually cause infertility.
Yes, and certain hormones can cause infertility, like something called follicle stimulating hormones, and which is responsible for the development of the follicles, which can be embryo at the end with the sperm, or something cause the sperm, affect the sperm production, which can cause mutation to the sperm, or a lose of motility of the sperm. All these can cause infertility, because it affects the natural intercourse process, and can be treated definitely with many methods and technologies.
A second question would be, people have been told do not cycle so much, especially men. If you're in a boda or you cycle a lot, if you work out, or be careful because that can cause infertility. Is that true? It's just another misconception.
No, it's true. It's true. It's true. You can avoid cycling, or avoid also temperature and high temperature, like warm baths and hot baths and all this for men. It can cause really infertility as well. So avoid these things will enhance infertility.
What's the cause behind it?
There's too many things will affect the sperm and the medium of the sperm, and a lot of explanation, which could affect the sperm production, motility, and morphology as well.
It's interesting when it comes to cycling, because not so many people think that can actually affect infertility. I read about the boda story, and the men were saying no, the association was saying no, it doesn't affect. But then other people say, doctors actually saying that yes, it does affect.
Yes, definitely it does affect. But sometimes you don't know what to do. Like, for example, chemical exposure, like pesticides. When you are a farmer and you spraying pesticides, it also affects infertility. Exposure to chemical, when you are working in a chemical factory or oil and gas factory, or company, it will also affect infertility. Paints, the people who painting, the smelling of the paint also affect infertility.
All
this you can read, inhaling, yes, definitely. So only you can read about this when you Google toxin or exposure to toxin and chemicals and infertility. you will have all this.
Yeah.
And also if you Google heat and cycling and infertility, all this information now available on Google and many medical societies websites. They advise what to do and what to avoid and many other things.
Interesting.
Yeah.
All right. And then now, what are options that are there for treatment? What options are there for treatment?
I will not speak about treatment because there is too many options. It takes a lot of time and more experts people than me to speak about it. That's why, I mean, you need certain specific training to be able to speak about these things. But there is options. Depends on the stages of the infertility.
Yeah.
If you discover it early, if you're still young, below 35 or above 35 years old, it's easier below 35 or below 30 even, and more difficult above 35 years old, and you need high technology intervention. So there is too many options. You will need to see a specialist, fertility specialist, to understand what is your option after you having the certain diagnosis. For every diagnosis, there is an option, 1 or 2 or 3. So it's there. Everything is there, but you need to know and you need to diagnose properly. Who is responsible? If it's you or your husband, if it's you both together, because also there is certain cases they are both responsible as a chemistry, responsible for, they have to both have treatment. Whether if he went to marry another one and she went to marry another one, they will have children without any intervention. But sometimes it's a combined intervention with these two particular couple, man and woman.
Yeah. And what is the success rate according to what you guys have seen?
Depends also again on the incidence and the stage. There, the success rate is easier and higher, much higher when she's when they're younger and discover the early diagnosis of infertility. Of course, the success rate is higher. It's getting difficult when it's older, definitely, because the follicles are less and less quality. And,
And is there like cases where a doctor can actually deny someone treatment because maybe from what you see, there's no help can be gotten? Are there cases that
depends on
happen?
the doctor, definitely.
Yeah.
If he is, for example, he's seen the case cannot be treated or he cannot do it, he will tell them, no, I don't want to waste your time and money. And maybe they can send them to somewhere else where is different technologies available or more experienced people in this certain case are there. But many of the cases can be treated by simple interventions and easy.
Now let's talk about something that is interesting. You talked about women actually being stigmatized in different parts of the country, even in Africa as well. What are some of those cases that you've seen that are really, really bad when it comes to women being ostracized because of the fact that they're fertile, even from relatives?
Oh my God, there is a lot of cases and stories we heard, and you can even watch more and more in our YouTube, Merck More Than a Mother, and website, because we have the stories of the suffering of the women and what exactly they suffered psychological or physical violence, like someone of the burn on their backs. There's ladies as well, which we don't have in the videos, get their hands and legs chopped and burned by acids because simply they cannot have children. Some of them, which you will hear their stories, they spend nights and days without food, deprived of food, and there's no place to sleep, and they sleep in the open air, completely isolated from the community, like a disease. So they don't even invited to funerals sometimes, and they have nothing else to do because they cannot even go to their families, back to their families, because they cannot inherit anything, because all the inheritance go to the brothers, and she cannot have anything unless if she has children. So she has nothing, no skill, no education, no support. So we actually met these women, as I told you, and we supported them by establishing small businesses. We are also open for all kind of these women to apply for our website, my story at merckmorethanamother.com. So if they have anything, we can help them to establish and train them to have independent and regular income, so they don't need anyone, and they can be their own person without any humiliation or acceptance, any discrimination.
All right.
So this one thing. Of course, when I went to Uganda also, I've seen a man who said that he married 35 wives and have no children, and he doesn't know. I mean, he must be cursed. So he didn't even realize that he can have to go to the doctor after the first, second, third, maybe. So and he keep only marrying another women because he didn't know. Genuinely, he didn't know that he can be the cause of infertility. He thought because she is the one who get pregnant in her body. She's the only one who caused infertility. When we told him this, he actually stand up and apologized for the community, apologized for his wife, the first wife who actually married on love, but he left her and abused her because she didn't have children, and he went to another one. And they told her that I want to come back to you and I will treat you like a queen. And it was really amazing. The community also, as I told you, stood up and they said, if we know that we are doing something wrong, we will not do it, and we will change.
So, I feel like there's a lot needs to be done when it comes to just creating awareness and giving out that information, right? This is the day, and we're talking about infertility and the misconceptions in Africa and some of those options you have for treatment, and also what can be done if you have an issue, as well as just creating awareness and making sure that everyone gets to find out what infertility is about, how can you get treatment, what can be done, and what options do you have. And in studio, as I continue with the discussion, the Dr. Rasha Kelej is talking to us about that, and she's also the CEO of Merck Foundation. And Dr. Ari, before we actually wrap up the conversation, someone is asking, does the DNA of the surrogate affect the child born?
No. I mean the father and mother of the child, or the embryo which is implanted in the surrogate mother, it's the DNA of these parents are the one who's in the child. The surrogate mother has nothing to do with the DNA of the child, definitely.
Before we wrap up, you have something you're doing about with the Merck Foundation. What are you in regards to infertility? Talk about that in 1 minute.
Okay, other than infertility, Merck Foundation also building capacity in oncology, and we have oncology fellowship program which
for infertility.
Not for infertility, for oncology as well as infertility. So we are not only addressing infertility, we're also addressing cancer, access, and diabetes and hypertension. So we're providing training and actually 1 year, 2 years, 3 years oncology fellowship programs for doctors across Africa, and also for diabetes 1 year diploma for diabetes and hypertension. For fertility, I would like the last thing is to speak about the media award, which is very important to call for all the journalists across East Africa to apply their stories, and has to be very moving and passionate stories about infertile women, and submit that at mystory@merckmorethanamother.com, mystory@merckmorethanamother.com, and also read and watch all our videos at www.merckmorethanamother.com. I think you will have a lot of things to learn, and any question you can send there as well on our social media.
All right, thank you so much for coming to the studio.
Thank you very much.
Thank you so much for tuning in. We'll do this again next week. My name is Harriet Kinga. This is the day, and of course every week 6 to 7 p.m. we talk about different topics, things to enlighten you, and of course next week we do it big as well. Thank you for tuning in. Let's do this again next week. God bless you.